Welcome back to Ronnie, I'm Joe B. Are you struggling to lift your leg to and from the bed after knee joint replacement? And also, are you struggling to stand for a prolonged period of time due to fear of knee buckling? If that's the case, in this video, we'll tackle effective ways and strategies to regain weak quadriceps muscle strength quickly after joint surgery. Let's dive in. After knee joint replacement, the cutting and reassembling of the quadriceps tendon can sometimes result to muscle atrophy. In addition to that, the post-operative swelling can also prevent adequate muscle contraction that would result to muscle weakness. There is a solution to regain quadriceps muscle strength quickly enough to allow ease of lifting the leg to the bed and also prevent knee buckling during standing and walking. I had a patient who recently had a total knee replacement, in which case the referring doctor, he believed he would be okay just to go straight to the outpatient rehab facility. During the initial evaluation, it was apparent that this patient cannot lift his leg to the treatment table because of difficulty in straightening the knee. In addition to that, during standing and walking, specifically the mid-stance phase of the walking cycle, the patient had to hold on tight to the hand grips of the rolling walker in order to prevent the knee from buckling and him losing his balance. During quadriceps muscle strength testing, I did not even see a wrinkling in the front of the knee or even a trace patellar superior glide indicative of a quadriceps activation weakness. In addition to that, when I asked my patient to do a straight leg raise, he was having a difficult time keeping the knee straight throughout the range of motion, all indicating a quadriceps muscle lag. As you know, the quadriceps muscle is very important in locking the knee during sit-to-stand transitions, straight leg raise, even standing and walking. To accelerate regaining quadriceps muscle strength, what you can do is you can purchase a neuromuscular electrical stimulator unit or an NMES unit online. Once purchased, you can turn on the machine and set the parameters in such a way that there should be a pulse width of 400 milliseconds or ms, a frequency of 75 megahertz or MHz, a ramp time of 2 seconds, an on time of 12 seconds, and an off time of 24 seconds. Eventually, you can progress the on and off time to 12 seconds each. Once the parameters are set, you can basically connect the wirings to the machine and connect it to the electrodes in such a way that you will place either a 2x2 or a 3x5 electrodes, with the first electrode above the patellar base and medially for the vastus medialis oblique muscle, and the other electrode will be at the vastus lateralis muscle belly, 3 finger breadths above the first electrode. Once the electrodes are in place and you connected it to the wiring, you can now start turning the intensity up until the patient feels a prominent grabbing sensation. Such prominent grabbing electrical current sensation will normally come in for 12 seconds and then it will go away for 24 seconds. That would be the 12 seconds on time and the 24 seconds off time. During the 12-second on time, you want to ask your patient to press the back of the knee into a rolled towel underneath while in long sitting to perform quadriceps setting exercises. This particular quadriceps contraction setting exercises is performed again for 12 seconds on, 24 seconds off for the duration of the electrical stimulator treatment, which is around 8 to 10 minutes. When you are instructing your patient to perform a quadriceps setting exercise, you want to make sure that your patient is positioned in a long sitting position, with patient looking down towards the knee in order to make sure that your patient is doing the correct exercise. There should be a visible wrinkling of the skin in the front of the knee or the patella moving upward. Once your patient starts regaining quad strength, then on the next coming treatments, you can progress the exercise to a short arc quad with the electrical stimulator with the same hold times, and eventually to a large arc quad with the same on and off time. Once your patient is able to do all of those, then you can progress it to a leg lifter exercise where the patient is seated And then without the electrical current, you will ask your patient to lift the leg to the bed and from the bed, keeping the knee straight throughout that whole process. So for those of you who have used the NMES unit for quad strength recovery, if you have any recommendations as to machine settings or any suggestions for better exercises that will activate your quads, please comment below. Now that you have regained your quad strength, you're probably thinking, when can you transition from a walker to a cane? If so, then watch this next video. Thank you so much.